Hi, this is Dr. Trudy Hall, and we're here at Region 2 National Medical Association Scientific Convention right here in Baltimore, Maryland. And we just had our first speakers for the morning. And this morning we had Dr. Basil Morgan. He's an ophthalmologist right here in Baltimore. I've known Basil for many, many years. We were just talking about how many decades we've known each other. But let me have him introduce himself, and then I have some questions for you because your talk was very engaging, and we had a lot of dialogue afterwards. But
Thank-
tell us who you are, Basil.
I'm Basil Morgan, a practicing ophthalmologist in Baltimore. And as Trudy said, we are real good friends for over 30 plus years. And I don't want to give her age away, but it's that length of time. And she has kindly invited me to be a speaker. And my topic was surviving in academic medicine. And I hope I impart a few pearls to the audience.
Yeah, I mean, Dr. Morgan, we know over 70% of physicians now are employed, and some of them are employed by nonprofit hospitals, but some are by academic hospitals. What did you share that was so important? I mean, the stuff really that doctors don't get in med school and residency. So, what were some key pearls of things that you talked about?
Well, most of us flirt with the idea of being, since we're type A personalities,
Hmm.
we want to be perfectionists and be on top of everything. So somewhere in our career, we flirt with the idea of being an academic physician versus being a clinician. And you have to kind of figure out what is it you're passionate about. Is it research, teaching, or is it taking care of patients? And I kind of like to have to do all of those. And so, but to me, the joy of taking care of patient surpasses research. It trumps that. But so in that respect, I try to be part-time. I'm part-time academic and part-time clinician. And I think I have the best of both worlds.
Nice, nice, nice. Now, you did talk a little bit about, and this was, I love this analogy when a physician is going to work for an institution, and it could be academic or non-academic. Their job is like a marriage, and the agreement or the contract is the prenuptial. Please, I love that analogy, but tell us a little bit about, that analogy and how it pertains to really getting a job.
Well, in terms of uh, looking for a job, you have to have your goals in mind,
Hmm.
okay? And you have to plan to execute getting to those goals. So, they say, my old professor used to say, proper prior planning prevent poor performance. So you have to plan out what you really want to do and be ready to accept failure. Failure, the experience of failing actually teaches you so much information, give you so much information so that you're less likely to fail the next time. And that's critical. The other part about negotiating an employment agreement. My father used to tell me, no man hire you unless they can fire you,
Mm,
and no
exactly.
man hire you unless they can make money on you.
Hmm.
So I've always felt that you have to be mindful of the economics because most academic institutions, by and large, are parasitical, meaning you're trading your skill set, your time, your efforts for economic return. But the economic structure favors them rather than you.
Absolutely.
And in terms of academics, let's face it, I'd rather be known in the banking circle than being in the academic circle. Because as beautiful as you look, you can't take one of those papers you publish, the Neiman
Mm,
Marcus,
okay.
or Nordstrom. So you have to keep your mindset firm about where you want to go. And the thing in when I came along, there was nothing in my curriculum in medicine in medical school that taught me about the business of medicine. And institutions, by and large, are in the business of medicine, but we are in the practice of medicine,
Mm.
and it's a different set of variables that you have and pitfalls that you have to deal with.
You brought up another topic, which was belonging, and really. once, whether you're in residency or fellowship, or if it's really an employment opportunity to work for a healthcare system or a payer system, African Americans having that sense of belonging. And what does that mean for your performance in your current state, but also what does that mean for your goals for a future state? So talk a little bit about that.
Well, for performance, there are metrics set that you have to meet to to be promoted in an academic institution, and they don't retrofit that because you're a black.
Mm.
You also have to remember you're carrying an added burden. You're not just representing yourself. You're representing, by and large, the black community, your neighbors,
Mm-hmm.
and you don't get there by yourself. And so when you get there, you have to maintain a certain amount of decorum, expertise, so that they recognize that you are just as rightfully belonging there as they are. You are matriculated, you have passed the standardized test, and you earn your rights. You're not there because of affirmative action. You're
Mm-hmm.
there because you belong there.
Belong.
And that's important because all the psychological games they play,
Mm-hmm.
the promotion, denial, it reminds me, it's like when you're at rounds,
Mm-hmm.
they ask a question and no one else knows the answer. You will give the answer, they ignore you. But then some white person get up and say the exact same thing you said. Right. All of a sudden it's important
It's important.
because it's now sanctioned by
Mhm.
somebody white.
Yeah.
So, but you have to keep in mind and keep forefront that you belong there. You have
Mhm.
as much right to be there, and you're just as smart as they are. Okay.
Mhm.
Most of these kids in my medical class anyway came from privileged background. They had no reason not to be there. Now we had to work our way there to prove ourselves at every point in the procession.
I'm gonna switch topics for a little bit. Dr. Morgan and I are from a little island called Jamaica, and I know we always are trying to give back. I know that you have been giving back to our island in many ways, but tell us a little bit about the work that you do there. And I know the last time you went, I know there was a YouTube clip that was showing really the tremendous work that you do there to help the people from our little island of Jamaica. But tell a little bit about some of your trips in there and the work that you do there, which is just so much dear to my heart.
Yeah, well, my father used to say, to whom much is given,
Yes,
much is
much is
expected.
expected.
And he also said, he actually told me he wanted me to come back to Jamaica
Hmm.
to practice. But since I didn't do that, I felt obligated to keep going back. But it's not just Jamaica. I've actually volunteered in many places. I've been to Kenya, Ghana, Nigeria, on many occasions
Hmm.
volunteering. And so Jamaica is easier, closer, and shorter. Now, why Jamaica? Because it's my people. I feel there's a sense of belonging. There's also something very important about volunteering. It makes you feel so good inside. You're
Hmm.
not doing this for money. You're not doing this for prestige. You're doing it for the less fortunate people.
Hmm.
And that gratification sticks with you everywhere. You also don't have the problems of overhead while you're doing that. And you're meeting other guidelines other than volunteering. It's one of the most truest form of giving back. And so going back to Jamaica is that's what I'm doing. I've done it many times, and I'm headed back there pretty soon
Pretty
to do it.
soon. Yeah.
Especially at this time, because Cornwall Regional Hospital, the major hospital that serves the western part of Jamaica, is non-functional.
Mm.
So there's a more than 3, 4 years backlog of surgery.
Mm.
So when I go down, I actually doing surgery something from 7 in the morning till 10 at night.
So your last trip, just so I can get a general sense of how many patients we're talking about. I mean, how many surgeries did you do,
We
like your
did
last trip?
31 cases in three
Wow.
days.
Oh my goodness.
And oh, it's fascinating because with the hospital non-functioning, the engineering department of the University of Michigan and Illinois got together and had a brilliant idea of converting shipping containers into a state-of-the-art operating room,
Wow.
complete with climate control. And what they did was they ship it down they create a pad, a piece of concrete. They just put
Mm-hmm.
it there, hooked onto the water supply, and they're up and going. And that's where we are working out of while the hospital gets refurbished.
Wow. Yep, I did see that on the YouTube, the shipping containers. That's just amazing. In closing, what are the final things you want to kind of to put out there to the audience about your talk today, and really just some final tips and pearls. Just in closing, what would you like to say?
Well, there's a retrenchment currently in diversity and inclusion, especially when it pertains to Black women. If you
Mm-hmm.
look at what's happening at Hopkins with Sharita or at Harvard with Gay, and you recognize that they're trying to decapitate what's going on.
Mm.
Black women, by and large, have been promoted in the past few years more than black men. And they hold the key to the household, to the performance of their children, and they vote in large number. Our current president wouldn't have been there without black women and sororities. And so in terms of, we have to be mindful of the fact that we have to get our women of color not to give up, because they're opening the doors and bringing us, the men, along. The other passion I have is trying to get more black student into medicine,
Mm-hmm.
and it's recruitment and retention. I spent 4 years on Johns Hopkins admissions committee, so I see the metrics that's required. And we
Mm.
need to get that downstream to the students so they can be prepared to be competitive in getting these top-notch medical school. So recruitment, retention, volunteerism, and clinical care.
Yeah.
My research interest has always been sickle cell disease. You know,
Amazing, amazing, amazing. Yeah, I'm just going to end with the final statistics. I mean, we are still at only 6% in medicine is African American, and it's been the same percentage for decades.
oh yeah,
And I'll be honest, if we don't take an active stance to have these programs and to really support, not only will that number stay stagnant, that number will actually start to decrease over time. But I just want to say thank you so much for
welcome.
coming and speaking at our Region 2 National Medical Association, and for being my friend for over 30 years.
And we're
So
open
it's a pleasure.
for the rest of our lives.
I absolutely, absolutely. Thank you so
It's
much.
always a pleasure.
Thank you, Dr. Morgan.